Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to the channel. Today we will talk about the diseases of nasal septum. So let's start our discussion. Before embarking upon today's discussion, you are requested to subscribe, like, and share the channel. There are different diseases which can affect the nasal septum, which is a medial wall or a partition between two nasal cavities. And this nasal septum, it has got three parts: columellar septum, then is the membranous septum, and then is the septum proper. So in the diagram, this is the nasal septum, and the caudal part of the nasal septum, that is what we call as columellar septum, which is consisting of the medial crura of the lower lateral cartilages. This is bluish is the cartilage, medial crura of the lower lateral cartilages, along with the skin folds. Just behind that, there is membranous septum, and this membranous septum is having only two mucosal folds, but between two mucosal folds there is no cartilage, because this septal cartilage of nasal septum proper, it ends here, which is the caudal border of this septal cartilage, and it does not come up to the columella, so that there is a membranous septum, and then this is the what we call as nasal septum proper. So columellar septum, membranous septum, and nasal septum proper. This nasal septum proper, it is made up of a septal cartilage, which we also call as quadrilateral cartilage due to its shape. Then is posteriorly is the perpendicular plate of the ethmoid, and posterior-inferiorly is a bone which we call as vomer. So these are the major osteocartilaginous constituents of nasal septum proper. Minor contributions are from rostrum of the sphenoid bone posteriorly. Along the floor, posteriorly is the crest of palatine bone, anteriorly is the crest of maxilla, then is anterior nasal spine of maxilla, on which the inferior border of septal cartilage is placed. Superiorly, minor contributions are from crest of nasal bone and nasal spine of the frontal bone. So this is what we know as nasal septum. Then arterial supply of nasal septum. This is from the internal carotid system as well, and from the external carotid system. From internal carotid system, the internal carotid artery gives the branches of ophthalmic artery, which gives branches of anterior ethmoidal artery and posterior ethmoidal artery, which supplies the superior part of the nasal septum. Then from external carotid, main branches are maxillary artery. This maxillary artery gives sphenopalatine artery and greater palatine artery, which supplies the postero-inferior part of the nasal septum, and the anterior part of the nasal septum is predominantly supplied by branches of facial artery through septal branch of superior labial artery. Then anteroinferior part of the nasal septum, that we know that is it is called as Little's area, and this is a richly vascularized area due to a plexus which we know that is called as Caselbach plexus. And if you trace this posterior ethmoidal artery, it does not reach up to the Little's area. So it supplies only the superior part of the nasal septum, but not the anterior part. While this anterior ethmoidal artery, it takes part in this Caselbach plexus along with septal branch of the facial artery, greater palatine artery, and branches of sphenopalatine artery. Nerve supply. we know that in the roof there is olfactory epithelium for olfaction, then nasopalatine and greater palatine nerve and infraorbital nerve they supply, and anterior ethmoidal nerve also supplies a portion of nasal septum. So different diseases can affect the nasal septum, including fracture of nasal septum, then it can be deviated nasal septum, septal hematoma, septal abscess, then nasal synechia or nasal adhesions, or there can be septal perforation. So in succeeding videos, we will try to cover all these topics one by one. Today, we will focus on what we call as fracture of nasal septum. So this can be due to trauma, and trauma can be sports injuries, it can be assaults, it can be road traffic accidents. So after trauma, the septum, there can be vertical or horizontal fracture of the septum. It can buckle down on itself, or it can be crushed into pieces depending upon the magnitude and force and direction of the trauma. Septal injuries which have got mucosal tear, they will present with epistaxis, and septal injuries without mucosal tear, it means that the mucopericardium and mucoperiosteum is intact, but there is septal injuries, there will be what we call as septal hematoma. The fractures of nasal septum, they are basically are of two types. One is Jarjaway fracture and the other one is Chevallet fracture. And mind you, these fractures are different from the fracture of the nasal bone, which we have already discussed, and in the description you can find the link for those videos and you can check it out. But my point here is, don't confuse fractures of nasal septum with fractures of nasal bones, though they can occur uh, collectively during the trauma, and we have to deal them concomitantly. Jarjaway fracture, it results from when there is blow on the nose from the front, and it starts just above the anterior nasal spine and runs horizontally backwards just above the junction of septal cartilage with the vomer. So this is a horizontal fracture. While the Chevallet fracture, it results from the blows from below, and it runs vertically from the anterior nasal spine upwards to the junction of bony and cartilaginous dorsum of the nose. So here you can see that if there is blow from the side, this is Jarjaway fracture or a horizontal fracture. It starts from the anterior nasal spine and it runs backwards just parallel to, this is the vomer, this is the perpendicular plate of ethmoid, and this is the quadrilateral cartilage. So just above and parallel to the junction of this quadrilateral cartilage with the vomer, this fracture line runs, and this is a horizontal fracture when the blow is from the side, and we call it as Jarjaway fracture. When there is a vertical fracture in the septal cartilage, we call it as Chevallet fracture, and this happens when the blow is from below, and again from the anterior nasal spine this vertical line goes above between the osteocartilaginous junction of the nasal dorsum. So this is Chevallet's fracture. Early recognition and treatment of septal injuries is essential. Any kind of facial trauma, fractures of the bones can be dealt with later on, but never miss septal hematoma. This is an emergency, because if septal hematoma remains undiagnosed, that can lead to very drastic complications later on. Dislocated or fractured septal fragments, they should be repositioned and supported between mucopericardial flaps with mattress sutures, and anterior nasal packing, which should be removed after 24 to 48 hours. Fracture of the nasal pyramid, they are often complicated with fractures of the septum, and these both should be treated concomitantly. If the septal fracture is overlooked, misdiagnosed, and not dealt with accordingly, then it can lead to certain complications, because it is very important in supporting the lower part of the external nose. So there can be deviation of the cartilaginous portion of the nose, and there can be asymmetry of the nasal tip, columella, or the nostril. So live in the present and be prepared for future. With that, we come to the end of today's video. Thanks for watching, and don't forget to subscribe the channel.